Welcome to the fascinating world of the hymen. In this video, we are going to dive deep into one of the most misunderstood and misrepresented parts of the female body. The hymen, often spoken about with mystery and surrounded by cultural myths, deserves to be understood with clarity and respect. So, let's start from the very beginning. The hymen is a thin, delicate, and elastic membrane located at the entrance of the vagina. Made of connective tissue and mucous membranes, it is a part of the female anatomy that varies greatly from person to person. Contrary to what many people believe, it is not a barrier that seals off the vagina completely, and it is certainly not a flawless indicator of whether or not a woman has had sexual intercourse. In fact, the appearance, size, shape, and even presence of the hymen can be drastically different among women. Some women are born with a hymen that is barely noticeable. Others have one that is more prominent, and still others may not have a hymen at all from birth. This diversity alone should tell us that the hymen is not a one-size-fits-all structure, and its role in defining virginity is more myth than reality. Understanding the hymen means moving beyond cultural assumptions and into the realm of science and biology. During fetal development, the hymen forms as part of the vaginal structure. It is generally considered a developmental remnant rather than a body part with an essential biological function. While many assume it exists to protect the vaginal canal from infections during childhood, this theory is not strongly supported by evidence. Instead, the hymen is simply a small part of the larger story of human anatomy, not a defining marker of purity, morality, or sexual history. To put it plainly, the hymen is not a gatekeeper of virginity. It is simply tissue that, like many parts of our body, exists in a wide range of natural variation. This is an important message because countless women across cultures have faced unnecessary shame, stigma, or even harmful medical practices based on the false assumption that their hymen tells the story of their sexual activity. But beyond cultural interpretations, there are some variations of the hymen that can impact health and require medical attention. One of these is the imperforate hymen, a condition in which the hymen completely covers the vaginal opening, preventing the outflow of menstrual blood and, in some cases, even causing urinary difficulty. This condition is relatively rare, occurring in about 1 to 2 out of every 1,000 infants, but when it does occur, it often presents during puberty when a young girl experiences symptoms such as abdominal pain, bloating, or the absence of menstruation, despite the onset of puberty. The solution is typically a minor surgical procedure to create an opening, allowing normal menstrual flow and restoring proper function. While it is rare, the imperforate hymen is an excellent example of why understanding anatomy matters. It's not just about debunking myths, but also about recognizing when medical care is needed. Other variations include microperforate hymens, which have a very small opening, or septate hymens, which have a band of extra tissue across the vaginal opening. These too can cause difficulties with menstruation, tampon use, or sexual intercourse, and like the imperforate hymen, they can be corrected through simple medical procedure. What is most important to note here is that these are medical conditions, not indicators of morality or purity, and they should be treated with the same compassion and medical approach as any other anatomical concern. Now that we have a clearer understanding of what the hymen is and the variations it may present, let's address some of the biggest myths and misconceptions surrounding it. One of the most deeply ingrained beliefs is that the hymen is a so-called seal that breaks only during sexual intercourse, causing bleeding that supposedly proves virginity. This idea has been perpetuated for centuries in many cultures, often tied to traditions that place immense pressure on women during marriage. However, this belief is not only inaccurate, but it is also harmful. The hymen is not a complete seal. It usually has an opening from the start, which allows menstrual blood and vaginal secretions to pass through. Moreover, it does not pop like a balloon or suddenly disappear after sexual intercourse. Instead, it can stretch, tear, or remain unchanged, depending on its structure and the activity involved. Some women may experience bleeding the first time they have intercourse due to stretching of the hymen or other vaginal vaginal tissues, but many do not bleed at all. This variability makes it impossible to use the hymen as a biological test of virginity. What causes the hymen to stretch or tear? While sexual intercourse is the most commonly mentioned reason, it is far from the only one. Everyday physical activities like cycling, horseback riding, gymnastics, or even stretching exercises can place pressure on the hymen and lead to small tears or gradual stretching. The use of tampons or menstrual cups can also impact the hymen, though in many cases, the hymen simply adjusts rather than fully tearing. Even aging itself brings natural changes to this tissue, often making it thinner, less elastic, or stretched over time. These changes can happen long before a woman has ever had sexual intercourse, which once again proves the point: the hymen is not a reliable marker of virginity. Medical research and expert opinion confirm that the hymen is not a trustworthy tool for determining sexual history, yet the myth persists in many parts of the world. Unfortunately, this misunderstanding has led to harmful practices such as virginity testing, in which doctors or others attempt to determine if a woman is a virgin by inspecting her hymen. The World Health Organization, along with multiple international health organizations, has strongly condemned this practice as unscientific, unethical, and a violation of human rights. Virginity testing not only causes unnecessary physical and emotional trauma, but also reinforces harmful gender-based stereotypes. A woman's worth, health, and morality cannot and should not be reduced to a thin piece of tissue that varies so widely in structure and appearance. It is time that we, as a global society, move past these outdated beliefs and embrace the truth. The hymen is just another part of human anatomy, not a moral judge. Even when it comes to rupture or stretching of the hymen, the experience is not necessarily painful or dramatic. For many women, it happens gradually over time, unnoticed and uneventful. For others, especially when associated with sexual activity for the first time, there may be mild discomfort, slight bleeding, or a temporary sensation of pressure, but it is rarely severe. The narrative that the hymen must cause pain or heavy bleeding is another myth that unnecessarily frightens young women. In reality, with proper communication, lubrication, and relaxation, first sexual experiences can be comfortable and even pleasurable. Fear and anxiety surrounding the hymen often contribute more to discomfort than the tissue itself. When we take a step back and reflect on all this information, one thing becomes clear: the hymen has been burdened with far more cultural and symbolic meaning than its anatomy warrants. Its role in defining virginity, purity, and a woman's moral standing is a construct of social traditions rather than medical science. While cultural values are deeply personal and meaningful for many, it is important to separate fact from myth to prevent harm. No woman should feel shame, guilt, or pressure because of the condition of her hymen. Virginity is not something that can be measured under a microscope or seen under a doctor's examination light. Virginity is a social and personal concept, not a biological status. By shifting the conversation from myths to facts, we can encourage healthier perspectives on sexuality, relationships, and self-image. Parents and educators, for instance, play a vital role in providing accurate sexual education to young people. Teaching that the hymen is not proof of virginity, that its appearance varies widely, and that it can be stretched or torn for many non-sexual reasons can relieve young women of unnecessary anxiety and help men understand their partners with greater compassion. Accurate knowledge empowers individuals, reduces stigma, and allows healthier and more respectful relationships to flourish. So what is the takeaway about the hymen? First, it is a thin, elastic membrane that varies greatly among individuals. Second, it has no role as a measure of virginity or moral worth. Third, while rare variations, such as imperforate hymens, can require medical attention, the hymen itself does not usually cause health concerns. Fourth, activities like sports, tampon use, or even aging can change the hymen without any sexual activity being involved. Finally, and most importantly, the hymen should never be used as a tool for judging or controlling women's lives. At the end of the day, the hymen is simply one small part of the extraordinary human body. Its presence, absence, or condition does not define who someone is, what they have experienced, or what their value is as a person. Each woman's body is unique, and every individual deserves to be treated with dignity, respect, and understanding. If you ever have questions about your own anatomy, or if you suspect a medical issue like an imperforate or septate hymen, the best step you can take is to consult a trusted healthcare professional. Doctors are there to help you with your health, not to pass judgment. And there you have it, a comprehensive look into the mysterious, often misunderstood world of the hymen. By debunking myths, exploring medical realities, and addressing cultural significance, we can see that this tiny piece of tissue should not carry the heavy weight of judgment it so often does. Remember, knowledge is power, and the more we understand our bodies, the more confidently and healthily we can live our lives. Stay curious, stay informed, and above all, embrace the wonders of the human body with respect and appreciation.